Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Robyn Begley, who is the Chief Executive Officer of the American Organization for Nursing Leadership, or AONL, and the Senior Vice President of Workforce and Chief Nursing Officer at the American Hospital Association, about the latest AONL Nurse Manager Fall Report and the upcoming challenges for nursing in 2025. So, hi, Robyn, how are you?
I'm doing well and delighted to be with you.
Yeah, thank you so much for joining me and taking the time. Um, so let's jump right in. We're here today to talk about AONL's report, the Trends and Innovations in Nurse Manager Retention, Fall 2024 report in partnership with Laudio. And I think this is a two-parter report. The first part came out in the beginning of this year. On nurse manager span of control. So I wanted to pick your brain about it. According to the report, nurse manager turnover is highest within the first 4 years of leadership. So I wanted to ask you, why is that?
Really good question. We know that nurse managers face very high levels of stress and burnout due to the very demanding nature of their role. As a former nurse manager earlier in my career, I can tell you it was the most challenging role that I've had in nursing leadership in my entire career.
Mm,
Nurse managers are responsible for patient care, for their staff, and that most times, the vast majority of times, includes staffing 24/7 for their units, budgeting, compliance with regulation. I mean, they are really the CEOs of their patient care area. Transitioning from a clinical role to a managerial role requires different competencies.
mhm,
Many times when nurses are excellent clinicians, they're identified as, superstars that should then, have that would then join the management ranks and have those skills innately. But there really are very different skills from a clinical nurse and a manager. And there needs to be formal training in leadership, in management, and administrative skills. And, that is variable among organizations. Some do have very formal training programs. Others are, kind of promoted and then just sort of are expected to learn on the job.
mhm,
Nurse managers, we know, work very long hours and maybe on call for to cover weekends, to cover the quote unquote off shifts, which, much happens on the off shifts. Hospitals and healthcare settings are very frequently 24/7 operations. So this can be disruptive to their personal lives. Work life balance gets a lot of attention, and this really is one of those areas that it's really challenging for a nurse manager. And this can strain their well being. We know that.
mhm.
One other thing, too, is the culture of the organization. This can significantly impact, the job satisfaction of the nurse manager. Some new managers may feel isolated or perhaps unsupported, finding it difficult to navigate their new responsibilities and feel confident in their roles, especially in those first few years. Many, and I don't want to paint that with a broad brush. Many organizations have very structured support systems for our nurse managers, but it is definitely one of those areas that we really need to make sure that there is the support that's required. And I guess finally, I would say that um, the nurse manager role can be very ambiguous. And many times, if a new initiative comes into play, um, who is left to actually make sure that it gets implemented and outcomes are monitored and measured, and it's the nurse manager.
Mhm.
So this can lead to confusion, a lack of direction if it's, not laid out very clearly what the expectations and responsibilities are.
Absolutely, yeah, and it sounds like nurse managers have a whole boatload of responsibilities, which I'm sure can lead to a lot of burnout. So, how does nurse manager turnover and I guess burnout in general impact the rest of staff?
That's something that actually there has been some work studying. And we know that, frequent changes in management can create a sense of uncertainty and instability among those units that have frequent turnover.
Mhm.
This can lead to decreased morale and job satisfactions as employees, nurses, the nursing assistants, the clerical support on those units may feel that their work environment is unpredictable. Um, I know, and I think we all know, those of us in the, that have worked in any industry know that when your manager or your leader changes, that it is a time of uncertainty. So, staff can lose trust in the organization if they see that managers are frequently being replaced, if they're coming and going. And this can also erode the sense of security and loyalty that the staff feels, to their organization or to their workplace.
Mhm.
We know managers, can vary. I mean, we would like to say that that there's consistency, but all managers, everybody has their own sense of communication style. Perhaps their
Mhm.
priorities may be slightly different, and this can lead to again uncertainty, but also inconsistent messaging and confusion among staff. If there's a manager that leaves and, sometimes not immediately replaced, there can be an interim person or one of the charge nurses or assistants can be asked to take on the role for a period of time. They can, have a different way of doing things. And so, this does not promote stability.
Mhm.
Strong, effective communication and trust takes time. And frequent turnover really disrupts this and makes it difficult for staff to form meaningful relationships with their managers. I know that in the past we've asked staff, what is, what keeps them? Why are they loyal to their unit? Why do they stay? And many times they say it's because of their manager.
Mm.
So, when we have that disruption, I mean, then we can have instability with nurses, with staff, and then, they may turn over as well, which really is not the cycle that we want to see.
Absolutely, especially in the middle of the nursing shortage as well. I'm sure that doesn't help at all. So from the leadership perspective, what do you suggest for CNOs who want to improve their nurse manager retention? What are your tips?
Okay, well, I actually have a number of thoughts on this specifically, and I just like
Hmm.
to preface it by saying that chief nursing officers respect and truly understand the importance of their nurse managers.
Hmm.
So, sometimes in some organizations there's an additional um, layer in between the chief nurse. In some cases, a nursing director who has a number of units. As we look at across the healthcare landscape, we see a lot of different structures,
Hmm.
but those managers are really the frontline leaders. And our CNOs are working on promoting a healthy work environment in terms of physical safety,
Hmm.
but it goes beyond physical, really creating a culture of psychological safety, flexible scheduling, and just, an opportunity for the staff nurses to feel like they're not just cogs in a wheel, but they actually have skin in the game and they have some say over, the work that they do and the environment that they practice in.
Hmm.
The managers need to feel safe, and it's up to the chief nursing officers and chief nurse executives to create that environment so that managers can feel safe to take some interpersonal risks, for example, to speak up, to quite frankly, disagree perhaps with some of the directives that they receive, and to surface concerns without fear of negative repercussions. They understand what it's like on the front line, and they have to feel free to be able to communicate that back to executive nursing leadership. And also, they have to feel like they can tell it like it is and not sugarcoat perhaps some of the messaging that they really do need to communicate to their leadership team. So, that's an important role for or an important environment for the chief nursing officers to create specifically for the managers and directors in this case. The nurse executives and the CNOs need to have resources and really advocate with, with finance, for example,
Mhm.
for resources to provide formal training and development for their nurses who are either aspiring to managerial roles and to leadership roles, or for those nurses that are in those roles. I mean, it takes continuing leadership development and education, because we know there's always something new to learn, and things are changing in healthcare very rapidly.
Mhm.
Nurse managers told us how important it is to actually see their leadership and to have communication conversations with them, not just quick flyby rounds where leaders will stroll through a unit, say hi, try to check in with the staff quickly, but really schedule time for managers to be able to engage in dialogue. So those are some tips. Probably have a few more, but I think those are the the top of my list that I would advocate for CNOs to make sure that they pay attention to.
Absolutely. Yeah. I like what you said a lot about creating an environment where they feel safe coming forward about things. It's that idea of like psychological safety in the workplace. I think that's super important. So, in the report, there were four priorities that nurse managers want CNOs and other leaders to address. And it was ensuring a healthy work environment, promoting leadership development, identifying new leaders early, and addressing role complexity. So, what are some strategies that CNOs can use to address those challenges going forward?
Okay, so the last two I didn't really delve into, but I'd like to speak a little bit about succession planning
Hmm.
um, and the complexity of the role. So most organizations have a succession plan for upper management and for executive management.
Hmm.
But those really successful organizations are planning for succession, at every level of leadership. So, that really involves, a formal plan, a succession planning framework that includes purpose, level, assessment, nurturing. And so, we know with the baby boomer retirement that we are creating space in leadership in nursing as well as many other professions, as we look across around across healthcare, but also across our country and other industries. So
Hmm.
there are really, many opportunities, perhaps back, several decades. I mean, nurses were their trajectory was very programmatic, but that is not the case these days. There are some young up and comers who are very willing and able to take on more, to learn and aspire to be, leaders.
Hmm.
So these organizations really need to do a deep dive and do that assessment, and really figure out what their staff nurses desire to do in the future. It is wonderful if nurses decide to stay on the clinical tract and perhaps become more proficient in a specialty area or go into a clinical track for advanced education. But there's also nurses that want to pursue nursing leadership as their specialty. And those are the ones that really need a career plan, career lattice, if you will, for opportunities in their organization that can provide, exposure to what nurses at different levels do and provide formal education as well as leadership development.
Hmm.
We also talked a little bit about complexity. Um, I really don't know that anybody understands the complexity of what the nurse manager deals with, in their daily routine. And we've done. You mentioned earlier that we've done a lot of work around span of control, but we've also done work. AONL has around, what are those different areas in a manager's role that require additional education? What can we do to take some of that complexity out of their jobs? For example, clerical um, work that could be done, by an assistant, by someone who is perhaps not a nursing leader or nurse manager, but can do things like scheduling, um, you know, uh, managing the logistics of their unit, supplies. I mean, it is so complicated when we look at what they're actually accountable for. And, some of the things that we know nurse leaders are now dealing with are 4 generations in the workforce. So, how can, they connect with those different levels of nurses and support competent? One big area that we are also AONL is working on is the area of technology and innovation. And these are skills that perhaps a decade ago or more, nurses weren't innately exposed to in their education. But we know now that technology and innovation is truly key to the future of transforming healthcare and making our helping our communities become healthier. And we have to embrace it and not shy away from it. So those are some skills too that we know our nurse leaders at all levels, including our nurse managers, really need to get better at. And it is not necessarily innate and something that you automatically know how to do. It's something that needs to be learned.
Absolutely. And so, speaking of moving forward as CNOs, what do you foresee being the biggest challenges in nursing in 2025?
Well, I mean, some of the challenges I'll say that we've seen in the past couple years, 2 years in particular, workplace violence. I mean, healthcare is not isolated from society. So, one of those unfortunate things is that, mitigating workplace violence and promoting workplace safety is really, really important. So that continues to be a challenge. Although everyone is working very diligently at strategies to protect patients as well as, all staff. Well-being, we talked a little bit before about just the work-life balance. That continues to be a challenge for nursing. Staffing, retirements and nurses in the first few years leaving the profession are things that we are actively working on. That will continue to be a challenge. We know that many hospitals and health systems in our country are facing grave financial constraints. So that is also a challenge. And I think, the speed of play, which is a challenge but an opportunity, and the introduction of technology and innovation into the care delivery settings is a challenge, but also, as I mentioned, really an opportunity for us to dig in and participate and get things right.
Absolutely. Yeah. I think I just spoke with Peggy Norton Roscoe, who's the CNE at the University of Maryland Medical System. And she said the same thing about workplace violence, especially that it will continue to be a challenge. So I think 2025 will definitely be interesting. Speaking of those challenges, how do you think nurse managers and CNOs can work together to address them?
I don't think we can communicate enough and in different ways. So, communication, communication, communication.
Mhm.
Regular, check ins that are scheduled, that aren't just, catch as catch can, but really, rise to the top from the perspective of importance. That's really important. Provide opportunities for feedback from nurse managers and nurses. I mean, I think that, we're talking about nurse managers obviously in this conversation,
Mhm.
but it really is about, all levels of nursing to communicate. We need opportunities for nurses to provide feedback. Policies have to be and are best set when they're developed jointly. So,
Mhm.
co developing policies and procedures with staff input, with managerial input, not coming down from on high, if you will, are really important. Collaboration on joint initiatives. And I think, we know that we have to use data and the importance of analytics to make informed decisions, not just this is what we sort of intuitively know, but what are those things that we have data and analytics to support. Those are some things that I think will really help us in all those, challenge areas.
Absolutely, yeah. I think, especially with data, with AI and all these new technologies coming out, I think it will be a critical kind of new skill set for both nurse managers and CNOs to kind of become experts in. So I'm excited to see that unfold in nursing. So my last question for you is, do you have any advice for CNOs going into the new year?
Oh, um, as we look ahead, I think maybe we want to underscore the importance of what we just mentioned. Digital transformation, communication with your teams, and we're not going to get it right perfectly the first time we try something.
Mhm.
Perfect is the enemy of good. And I think so many times we want to roll out an initiative that we think we have um, accounted for all the possibilities and we just want it to be perfect. And we know in life that that's not what happens. And technology and, the digital age is advancing so rapidly, so that I think we have to be open to the idea that this is going to be iterative and we're not going to, first out of the box, just hit the home run and everything's going to be perfect. And that's hard for nurses. I mean, we are perfectionists and we want things to be right for our patients. Of course, we're always concerned about safety and quality. And I'm not suggesting that we have to, or that we should, cut corners in that realm. But
Mhm.
fail fast is the mantra, of those that are doing quality improvement work. Like, try a little something, a small test of change, see how it works. Get the input of the folks on the front line, the staff, the nurse managers, and maybe we need to change. So we need to embrace the digital transformation. As you said, it's about new competencies for all of us.
Mhm.
It's not just about a new IT system, but it really is about how we think about delivering and experiencing healthcare. I know that we all, when I go personally to my provider's office, I mean, when they have all my information and it's available and I don't have to re-enter everything, I think that's a wonderful thing. So,
Mhm.
we just have to remember, what the impact is on our patients and their families. We have to embrace, new technology, embrace making care more patient centric. And, I know that, the American Hospital Association recently has, this past year, done a deep dive into patient safety and found that in many impressive areas, scores and metrics have rebounded and exceed what we were seeing pre-pandemic. So I know we had a couple very rocky years during the pandemic, but we know now that we're on the upswing.
Mhm.
And that is ultimately to advance health care for all. And we want to make healthcare more accessible, personalized, and effective. So, we need to really understand our digital technology and get the feedback from frontline nurses about the benefits, the challenges, and also what's frustrating to them. What should we really dig deep and ask our colleagues help in other industries, like in transformation, like in IT, to help us with. So, those are some things that I think, you know, we'll be looking at for 2025. At
Mhm.
AONL, we have a learning community of almost 500 organizations that every month gather to, to learn from each other. And this is the way that we're going to advance, care for in our hospitals and health systems for our community. So we're really excited about that. We've seen some amazing technology and digital technology actually be advanced. And we're sharing that freely. That is not something that we want only to utilize in our particular healthcare organizations. The amount of collaboration that I've seen across the country has just been remarkable. And I think that that will only increase in 2025.
Absolutely. Well, thank you so much, Robin, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights. And thank you so much to our audience for listening.
It's been my pleasure. Thank you very much.
Yeah, thank you.